My name is Brooke Morriss, and I'm going to be presenting to you today on varicose veins. Varicose veins are elongated, dilated, tortuous veins, which are most commonly found in the lower extremities. Primary varicosities occur without deep venous incompetence, and secondary varicosities are caused by vein thrombosis or deep valvular incompetence. Approximately 20 to 25% of American women and 10 to 15% of American men suffer from some type of varicose veins. Approximately 50% of those over 50 years of age have varicose veins, and varicose veins may return even after treatment. Varicose veins can occur anywhere in the body, although they are usually located in the leg. Risk factors for varicose veins include pregnancy, obesity, age, being greater with advanced age, being female, occupations requiring long periods of standing, having a family history of varicose veins, and also having congenital abnormalities. Some causes of varicose veins include genetic factors or having a history of venous thrombosis. So how do varicose veins occur? Initially, it was thought that varicose veins were caused by valvular incompetence. However, more recently, it's been hypothesized that changes in venous wall structure causes weakness and altered tone, which then leads to valvular dysfunction. This valvular dysfunction causes blood to flow away from the heart instead of toward the heart and creates a volume overload in the veins. The increased volume and pressure in the veins causes them to twist and dilate. I like this image on the right because it's a good example of the difference between normal veins and varicose veins. On the right, you can see those veins are kind of twisted and bulging, and the blood is flowing not in a unidirectional flow as it should. It's kind of going wherever. But on the patient's right leg, it's showing that the normal veins are the size they should be, and blood is flowing in a unidirectional pattern. Varicose veins occur in the great saphenous vein and its tributaries below the knee, in the great saphenous vein above the knee, in the saphenofemoral junction, or any other superficial or deep venous segment. Signs and symptoms of varicose veins include dark or purple-colored veins, veins that appear twisted and bulging, an achy or heavy feeling in your legs, itching around a vein, burning, throbbing, muscle cramping, and swelling in your legs, or worsened pain after sitting or standing for a long time. And I like this picture because it's a great example of how varicose veins look from the outside. So you can just see exactly where those veins are. They're bulging, they're discolored, and they're kind of twisting in weird patterns that shows that there's not a unidirectional flow in there towards the heart as it should be. Diagnostic modalities of varicose veins include duplex ultrasonography, which is non-invasive evaluation of blood flow through veins and arteries. Ultrasound uses sound waves to produce images of the veins in your body. Continuous wave Doppler is a technique in which the transducer emits and receives the ultrasound beam continuously. It uses red blood cells to study flow through the vessels. Plethysmography is an instrument used to measure changes in volume within an organ or the whole body, and venography is radiography of a vein after injection of a radiopaque fluid. It's possible for ulcers to form on the skin in cases of very severe varicose veins. The skin usually becomes discolored before an ulcer forms. Thrombophlebitis is another complication with very severe varicose veins, and it's an inflammatory process that causes a blood clot to form and block the vein. Varicose veins very close to the surface of the skin may burst and cause minor bleeding. However, varicose veins are usually not considered a medical emergency, and treatment options are mainly for cosmetic purposes or to relieve symptoms. Compression stockings help relieve the symptoms of varicose veins. They improve circulation, and these are the most common treatment option for varicose veins. Another treatment option is injection sclerotherapy, where injection of a solution is directly into the vein. The solution causes the vein to scar and blood to be redirected to healthy veins. There's also ultrasound-guided sclerotherapy, which uses ultrasound guidance to inject a solution into the vein. Radiofrequency ablation is another treatment option for varicose veins, and this one uses a radiofrequency or laser energy to cauterize and close varicose veins in the legs. It may be used for cosmetic purposes, but it is most commonly used to ease symptoms such as aching, swelling, skin irritation, discoloration, or inflammation. Transilluminated power phlebectomy is a scoping device passed through an incision through which abnormal veins are removed. There are several surgical treatments for varicose veins. One of them is ligation or stripping, which is surgically tying the veins through a small incision in the skin. Another is stab avulsion phlebectomy, where several small incisions are made in the skin through which the varicose vein is removed. Another one is a valve transplant, where deep vein valve reconstructions and vein bypass involves either direct vein valve repair or replacement, and this one usually requires hospitalization. Some differential diagnoses for varicose veins include nerve compression, arthritis, deep vein thrombosis, peripheral neuritis, Klippel Trenaunay, or lymphatic obstruction. So my case study was a 50-year-old male. He worked long hours as a cashier, so he was on his feet for 8 to 10 hours a day, and he also had a history of smoking. He presented to our clinic with prominent enlarged veins in the medial aspect of his right leg for over a year. He also had pain and swelling in his right leg for 2 months, and his doctor ordered a venous ultrasound examination on the right leg. In these images, you can see that his veins are very dilated. You can also see he has backflow through his lesser saphenous vein. So everything above the baseline is flow that's going away from the heart instead of towards the heart the way it should. So you can see a big surge of it in the bottom left picture, and there's also a long pattern of backflow in the top right picture. And then you can see where his vein bulges in that bottom right picture as well. His ordering doctor was notified of positive varicose veins in the lesser saphenous vein, and the course of treatment will be decided between the doctor and the patient. However, again, varicose veins are usually not considered a medical emergency, and treatment options are mainly for cosmetic purposes or to relieve symptoms. And here are my references. Thank you.